I have the pleasurably easy task of introducing the only person on this agenda who does not need an introduction, which is good because I'm not great at introductions. Or as my 13-year-old boy said to me when he saw the agenda last week, he said, "Mom, you got Steve Ballmer? Steve Ballmer, do you know who he is?" And I was like, yeah, I know who Steve Ballmer is. He owns the best team in the league. I was like, yeah, Simon, he's done a couple other things too. But, so with no further ado, Steve Ballmer, owner of the best team in the league.
Well, thanks. It's a pleasure to have a chance to be here. We lost last night.
I know, I heard. I'm sorry.
Keep your son on the right side of the equation on that. It's, like I said, it's a pleasure to be here. It is beyond bizarre for me. I've given speeches certainly about technology, and I've given speeches and discussions certainly about basketball. I'm way newbie on the topic of the conference here, but I thought I'd share some thoughts. Over the last year or so, I've joined my wife Connie in a focus in on our philanthropy, and I call it civic activism, since a lot of what needs to happen is probably public systems reform. And we decided to focus on one issue, which is intergenerational poverty in the United States. That's the only thing we focus in on. And so for me, it's been a journey to understand, quote, the issue and how to approach it. I had a chance to go through some of what Raj said yesterday, and let's stipulate that the best thing to help everybody is to have continued GDP growth. But in my mind, that depends upon kind of innovation and productivity from the private sector. We're not going to get anything on job growth, really, from the government except short-term blips. That's my opinion. Economists can reasonably disagree with me about that, I suppose. And what it really means then in terms of intergenerational poverty is deciding what to focus in on. We focus in on this notion of mobility. Could focus in on inequality. Could focus in on absolute standards of living. We've decided to focus in on this notion of poverty that persists. You could say the measure, if you will, is if you were born at this point, if your parents were at some point on the income spectrum, like Raj talked about yesterday, what is the probability that you are higher up on the income quintile than your parents were? Now, in the grand scheme, for everybody who moves up, somebody's got to move down. We just want to see some people moving up. In a perfect world, it's 20% chance, no matter where you're born, that you'll wind up anyplace else. 25, 26, 27 probably is okay. But if you, as some people do in this country, if you're born in the bottom quintile and it's 50% likely that you'll stay there, that's, at least in our opinion, that's not okay. I actually co-teach a class with Mark Duggan over here for Stanford undergraduates. This happens to be the focus of our class session, our seminar session this afternoon. So I'll have a chance to hear what 19 bright, assuming everybody shows up, 19 bright Stanford undergraduates have to say about the topic. For me, coming from the business world, all I can basically do as I got started was try to apply the same kind of thinking that I would have done. First thing, intergenerational poverty, I'd say, who's the target, quote, target customer? How many people, how many children, because if you're focused on intergenerational mobility, the question is children. How many children are we talking about? Where do those children live? What do they look like? How do you reach them? How many are urban? How many are rural? How many are white, African American, Hispanic? What does that picture look like? So that if you want to serve, I'll call it again, that customer, what do you need to do to try to, you have to know who you're serving and how you're going to serve those people. There's a question of what to do. when I started with my wife Connie thinking about these things, I almost wish there was a book called, Poverty and Mobility for Dummies. There's a lot of really beautiful papers and books with academic rigor that tell you the world is challenged in this way. And I was looking for the practical guide that says, okay, who, what, where, and what do you do? I knew there wasn't going to be the one formula at the back of some book that says just do X, Y, and Z. But it's really hard to get your mind around this. How much money does government spend in this area? How much money does philanthropy spend in these areas? Where is the money applied? What do people think works? All of these are issues. One of the big revelations I had is that most of the money government spends is not about opportunity. It's about supporting a sort of a lifestyle, if you will, that allows people to not be in abject poverty. In poverty, but not as abject poverty as it otherwise would be. But the amount of money that actually says, hey, we're going to help lift you up or give you the opportunity to lift yourself up in a way that's differentiated. Everybody gets to go to school, but what is differentiated really in what we do for kids who are born into a situation where the probabilities, if you will, are stacked against them. The issue becomes the what and the how. What do you really do? On any atomic issue, you might find these so-called evidence-based, blah, blah, blah. I do say I find that people want a higher standard of evidence base in this business than they do in the medical industry. Mm-hmm. Doctors have less evidence base for something. I mean, I'm going to get a foot surgery, and I guarantee the guy's going to say, yeah, I think I probably know what it is, but we'll learn more when I go in there. This industry seems to want more than doctors do, which is kind of a head-scratcher for me. But, in that context, you say, what can be done? I start with how many things can be done on, let me call it a national kind of simple basis. What can you just blow out to everybody in an undifferentiated way, but is super easy, quote, to scale, because you're just putting it out there. And then how much needs to be done with what I might, kind of in a military sense, call a ground war, where you really have to be in the trenches, working in a certain way that's very difficult. In most businesses, you're looking for things where you can just blow out a solution, quote, have a product. Not clear that works in this area. Which interventions? How much is about education? How much are about behavioral health services? How much are about kind of mental health services for kids who are born in families of extreme dysfunction with a lot of adverse childhood experiences? What do you do? How do you bring it together? What's the management model? What does that mean? Well, if it was a business, you'd have a management model. You'd say, okay, command and control, you're going to work on this problem in this place, you're going to work on things that are national, boom, 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 boom. Well, even government's not prepared to have that management model. I was talking outside to Megan Smith, and she was talking about open source, which is a management model of a form in the tech industry. This problem doesn't even have open source. Even if people were better at, quote, sharing best practices, it's not in open source about sharing best practices. It's about having loosely affiliated parties collaborate on a single goal and a single thing. What is the management model? What is the equivalent, if you will, that has promised to make a difference on giving kids who are born into a situation where they have low probability of doing any better than their parents, a higher probability? Some people say it's about equality of opportunity. That's what I think it is. It's about equality of opportunity. But if nobody does better, it's hard to argue that you've created equality of opportunity. And I think one of the big discussions, I hope one of the big discussions as new administration takes over is to focus in on equality of opportunity. I think that's likely to be a good dialogue. On the other hand, people better actually be realizing more opportunity, or it'll be hard to believe that sort of the approaches are really working. So with that, I'll stop, and I think mostly we're going to do Q&A with Elisabeth and I, and then with the audience. I appreciate your time today.
We'll get here. Thank you so much for joining us this morning.
My pleasure. Thank you.
And I know it was a bad game last night. I'm sorry. I was told by many people that I was not supposed to mention the Clippers this morning because it was not the time.
All press is good press.
But they have had an awesome run, and it's just, you know, they're blips. We all have setbacks, right? So one of the things that's honestly burning in people's minds is, I mean, you're known for a lot of things, including owning the best team in the league in my house. But philanthropy is something that's relatively new to you, but not to your wife. It's something she's been very dedicated to for a very long time. You're more known for things like, you know, running one of the biggest companies in the world and, you know, things like that. My husband and I met in law school, and I often tell him, maybe this is an excuse, that his best thinking often comes out of arguments that he has with me. Tell us a little bit about, in that context, how you came to get invested in reforming government and philanthropy.
Well, it started with a discussion after I retired. My wife Connie's been working in child welfare issues and other issues that affect opportunity for children for 10 plus years. And I retire, and yeah, I frankly had not thought 1 minute about what I was going to do after retirement until the day I retired, because that's kind of my mode. You work till the last day, and then you start on the next thing. Yeah. And Connie said, okay, now it's time for you to pitch in and help. We have unique opportunity to make a difference. It's time to go. And I basically said, you know, the best thing we can do is just, not the best thing. I was being a little lazy, I'll admit. I say, okay, you know, philanthropy, all we have to do is give our money to the government. The government takes care of the sick. The government takes care of the poor. The government takes care of the old. Let's just pay our taxes. And I got a very cynical look. And I said, okay, well, I'm not going to get away with that answer. But it did cause me to want to study what government does with the tax money. And I figured out. The government mostly gives money to the sick and the old and the unfortunate. That is what really happens, but it's insufficient. It is insufficient. But at the end of the day, the #1 philanthropy, and it'll always be, is the US government. And unless you can or not the US government, it is governments in the United States. It is arguable in the area that we're interested in, state and county government is more important than the federal government. It is easily arguable, but they're both important. And then you say, okay, how would people who have, as we do, some time, some resources, some energy, some connections, how do you make a real, an impact enabling people to work on these problems? Because we are not gonna solve anything. We're going to enable people who have a lot of energy and passion to do something good. And I hope out of what we do and others do, you find some things that are, quote, replicable or, quote, scalable, so that everybody's not reinventing the wheel, and that this field can become a little bit more like medicine when there are a few things that are replicable and scalable, and yet at the end of the day, doctors tailor individual treatments to individual patients. I think that probably is what needs to happen conceptually in this area.
Yeah. You said a lot that the biggest philanthropy in the US is the government, and I think that's right. When you look at, we talked a lot yesterday actually around the size of just even sort of the social impact sector, which is over $1 trillion a year. And frankly, to your point about how you target or even what data and evidence is being required, it's less than 1% of that is actually really being targeted towards sort of pay for success, evidence-based outcome type of funding. So you've been doing this big 10K for government. When you look at the data, how effective do you think that big philanthropy is at helping people? And, you know, given what you see, where do you see your role, or where do you see the role of traditional philanthropy coming in and having the most leverage?
I actually think in some dimensions it works super well. I don't think the government does anything to help the economy, particularly in a long-term sense. But I do think government does a reasonable job, quite a good job actually, of supporting a better standard of living for people who are poor. I'm not going to argue that it is perfect, but the degree to which money gets transferred in a reasonably effective form from more affluent people to less affluent people through EITC, through Medicaid, these things do work. They really do improve the quality of people's lives. They don't do much to help people seize opportunity or give people who are in tough situations the opportunity to do better. When you look at all the money, we would say in the analysis, and I'm sure it's partly definitional, but we would say it's approximately, I wrote the number down because it's a world of numbers for me. It is approximately $700 billion that gets spent. $400 billion of it is on Medicaid. Do I think that's all well spent? The answer is yes and no. I think the medical industry is in need for an efficiency improvement, but that's not really the problem we're talking about today. That's another government problem. Does Medicaid pay for some things it should pay for? It depends state by state how much work you get on mental health and behavioral services, which I think is a big deal because kids born into dysfunctional families, you can have all the good teachers and all that, unless there's something to help those kids, I think you have a different problem. Then you have roughly $160 billion of it that's in cash or cash-like transfers, EITC, SNAP, TANF, et cetera. That $160 billion, probably well spent. My basic concept that says it's not terrible to just give people some money. It's as good as people's decisions on how to spend that money. The last roughly $140 billion is a mess. I'm not saying it's all bad, but it's a tangled web of little programs essentially it pays government contractors. Most not-for-profits are like government contractors because the bulk of their budget comes through these things. And yet, if you are one of these not-for-profits trying to do this work or being managed by the rest of the $140 billion, it's kind of a nutty thing. We just hired a lady to work with us on philanthropy in LA. She was #2 at a thing called the Children's Institute. Budget $65 million a year, 68 different government contracts that she had to try to think about how to weave together to help the kids in their service area. In my mind, that doesn't sound very effective, mostly because it's very hard to go from input to output.
Yeah, and I think, one thing you mentioned is when you think about sort of the quote-unquote evidence-based outcome funding being only a sliver of that, that doesn't mean that many of these programs don't work. They may work they may not be perfect, but many of them do work. And I do think there's a lot of evidence of things like EITC or Medicaid actually having huge impact, intergenerationally actually, on things like poverty. Yeah. I think that one of the things that's very interesting about the way the structure of the government works, both on the federal level, but then through devolution, as you sort of referred to in states, is this issue of the inefficiency in the delivery mechanisms themselves. So even if you have a great program, like EITC, which I think is very well supported on both sides, and there's very good evidence for. And you have something really reasonably good like Medicaid that helps a lot of people. The fact that people don't get their Medicaid or EITC together, or that you don't find that the people who get Medicaid also are drawing down their EITC, the drawdown numbers aren't perfect, the inefficiency in the delivery mechanisms, both between the federal and the states and within states, is very complicated. What do you see when you look at sort of the government and looking at this data around inefficiency, and do you see any lessons, having run one of the biggest companies in the world, that could be applied or should be being applied to this sector from your experience?
Well, the specific problem you talk about, I can't say I focused in on much because I think the most efficient thing the government does in this area is transfer. Medicaid, EITC, SNAP, those are reasonably efficient. They may be a pain in the neck for citizens. They may be underutilized.
They're underutilized.
Those are all worth working on.
Right.
Just not particularly our primary focus. Could be at some point, because they help raise standards of living for parents and children, which is a great thing, but they don't do much to uniquely help a kid born into that situation do better. Yep. It's probably hard to think about kids who are born in abject poverty having any chance. So the government needs to, and again, could be more efficient, but it needs to raise the tide. And I would say that's probably the most efficient thing the government does, even though it may be able to be improved. It's all the things that say, okay, now here's roughly in the United States 15 million kids. What's being done uniquely for those 15 million kids? People say, well, they get to go to school. They need things that, teachers teach math. They don't teach life skills. There's no sense of, we have problems at home every night. What do we do?
Yeah. No, I think that's right. And I think one of the interesting, some of the interesting propositions that are coming out now is how do you combine those transfers with specific levers that we do know propel people on a path to opportunity, like college aid or preschool or things like that, so that you can use both the kick or the incentive of the transfer and the weight of the program to move people forward. Let's talk just briefly about scale for a second. Scale a little bit in this world is sort of, it's like your developers chant. I feel like anytime you talk to anybody, it's about scale, and that's all they want to talk about. I'm a victim of that too. But scale to me, to some extent, is sort of like, it's sort of like people's, for lack of a better term, screw you number, right? No one can sort of agree on how big it should be, but we all know it should be big, right? Well, actually, it occurs to me you're not the right person to be talking to about a screw you number, I guess. You have exceeded that, probably. But the rest of us are trying to figure out how much would we need to have to walk away in times. How do you define how big scale should be? When you look at that customer, and you see, the customer, the target audience, the children you're supposed to be reaching, how do you actually figure out where they are, who they are? One of the big questions in this sector is, one, how do you even define who you're trying to reach? And then, what does success or scale look like for you in terms of impact? How do you think we should be thinking about that?
Okay, again, I'll use the 15 million number, because I'm actually going to use a number that's 13.5 million, because as we think about it, you need to know where kids live and whether they are, quote, intergenerationally poor or just poor. Somebody's always going to be poor, and the government can lift the boat, but the question is, who's trapped?
Yeah.
And with 3 criteria we're using now, so you can't measure it. Unless Raj gets his data sets filled out, which he says he's working on, and I think that's great, he measures at a very large geography called a commuting zone. But you actually need to know down to the neighborhood level who you're trying to help. And there's 3 criteria we applied. Is poverty concentrated? Is there persistent unemployment? And what do test scores look like in the 3rd grade? That's about 13.5 million kids. So you say, okay, we want to target all those kids. Now, then you say, well, with what? Well, you can say with every program, but the real answer is, how do we improve the probability that those kids do better? And you say, we'd like that to be true for a significant part. I think right now the money focused in on that not individual interventions work, but the probability of things getting better for kids is not going up. It's staying flat or going down. Some of it's a dual generation problem. You got to help the parents more to help the kids. How do you think about that? How do you think about scale in that context? Is it about what I would call in kind of my old world, is it about a product? You just, you throw a new program or a new transfer out there, and it works. I love that. That's kind of like a piece of software. No, yeah, it's even good analogy. Piece of software you just throw out there. A cloud service you don't. It actually has an operational infrastructure. Yeah. So is it a product or a process that we're trying to scale? I think at the end of the day, individual programs can scale and still get no outcome.
Yeah.
I think most programs don't scale very well because the contractor who does this in LA versus the contractor who does something just slightly different doesn't scale. So the thing I think is most interesting right now is, yes, scaling, given interventions so people can move them more broadly, ones that work or evidence-based, blah, 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 blah. And I think there needs to be a focus on process. What's the process that you can scale? What does that look like? Is it the process of delivering the interventions? Is it the process of galvanizing communities and neighborhoods around the process? What is it? I would hope, in the perfect world, you're just scaling a product. It's not going to be that easy. So the question is there a replicable process that can be promoted or enforced or driven, either by government or just adopted by some public-private partnerships in cities, communities, neighborhoods around the country that serve these 13.5 million kids live?
It's fascinating because I think that there's not a lot of thought put into that, actually. I mean, I think we're starting to talk about scale on the product. And I think there are actually all these process issues and also process barriers that are really deep and need to be addressed if we're going to get there. I know we're almost out of time, but we did start late, so we're going to steal a little bit of extra time because I know there are a lot of folks out here who want to talk to you and have questions. So around the room, anybody who would like to ask a question? And introduce yourself briefly, just one sentence. Say your name.
My name is Ballmer, and I run a tech diversity nonprofit called Stanford. So what you said about process versus product and scale is really interesting to me.
That's very interesting.
And, I'd love a little more detail on that particular examples on what a scalable process might look like. Then specifically wondering if, say, a culture might count as a process, if that makes sense.
Yeah. Let me a comment or two about the second, and then I'll have more on the first. Culture, I think, could be part of it, but I think people have their own unique culture, and that makes it hard to think about scaling. What are the issues for somebody who grows up in the Mississippi River Delta? Do they really feel the same as somebody who grows up on the border of Mexico or on an Indian reservation? Hard for me to, I'm not saying you can't be there, but that's probably one where I've said, whoa, that gets too close to how people identify, how they think about themselves, how they want to live. So I haven't thought about it very much. I've just thought it's hard. As it relates to process, I've kind of gotten fascinated by the work a not-for-profit does called Strive.
Yeah.
They got 58 communities around the country, and all they really bring is a management process. How do you bring a community together that wants to come together? How do you get people to collaborate? How do you use common goal? How do you come aligned on common goals? Can you do that? If you're going to do that, how do you do whatever you need to do to measure those goals? Call that data, if you will. What do you do to use information as an aligning force and common goals as an aligning force? And then how do you do continuous improvement against that? To me, that's a management process, and it can be applied at a local level. And it's going to worry about how to take various interventions based upon the priorities that that community sees for itself. It's going to figure out which not-for-profits can do X, Y, and Z. If it needs to, quote, braid or mix and match money, it's going to scratch its head and say, you know, the subgroups focused on these things will put their heads together and say, how do we do that in a collaborative form? That's something I would call management process. And is it scalable? They're working hard at it. They got 58 communities trying to do it. We'll find out. 58 probes, data sets will kind of tell us whether that management process is both effective and scalable.
Yeah, I mean,
or replicable.
They've had incredible success, and I think a lot of it is around using data and but also trying to align a cultural interest that everybody's looking towards one goal, right? And how are you working towards that goal, and how are you moving through those other barriers of process to jump to the actual outcomes? We have time for one more question from the audience. So please introduce yourself and.
Hey, good morning. Dan Cardinale with Independent Sector, formerly of Communities and Schools. Thank you very much for your remarks. I'm interested, you mentioned a couple of times the important role of government actually as being the main source. A huge fan of Strive and a number of these community-based organizations. How are you thinking about taking the lessons learned from these processes that are scalable into the largest infrastructure, state and county governments, and accelerate impact?
Yeah, the thing that I think is most interesting, at least to me so far, is, look, there's only really two big pots of money focused in on, or three big pots of money. There's the education budget, but that also serves a lot of non-disadvantaged kids. There's a health budget, and there's cash transfers. And we've already talked cash and cash-like transfers. The thing that strikes me as perhaps most interesting is how yes, it's nice to teach math better. I'm not against that. But how do you use the fact that all kids somehow have an involvement with schools, not just to teach them math better, but to serve the whole kid? Whether you do that physically at the school, whether it's an adjunct to the school, or whether it's completely separate, but through data sharing and collaboration with the schools, you're able to make progress. I've read about a number of these Strive communities in collaboration as the community gets organized around it, getting collaboration with the school systems in whatever the targeted geography is seems to be a big deal. And it makes sense. If you want to get at kids, you can either go door by door and get them through their parents, but oftentimes the parents are dysfunctional, so not clear that's necessarily the point of attack. Or you can get them into school more. You can start them earlier, you can keep them later, and you can serve them in ways other than teaching them math and English and history. And I don't know if it works or it doesn't, but it's intriguing to me.
That's great. Well, thank you so much. I mean, I think the notion of, I have to tell you honestly, the notion of process as a scaling issue is not often talked about, and I think is rightly identified as a huge barrier to actually getting outcomes. I think where you center your work and how you bring it together around the child versus around the program is a key theme, and places like Communities and Schools and Strive have done a lot of work about this. They're in hundreds of communities. We have thousands more. So our next goal on scale, Steve, is figuring out how we get those answers out to everybody.
Solutions.
Exactly.
More focus on solutions.
It's got to be
little
solutions.
less on problems.
Exactly.
A little more on solutions and a little more optimism.
Yes.
I know, I guess there's this general pessimism. They told me, oh, the administration's changing. The good news, let me just give you good news. There's always some good with the bad. The good news is other approaches will also be tried.
Yes.
And those approaches may turn to have some merit too. And so look for the good that can come with some of the things that I'm sure people will ultimately decide are bad that may happen across the boundary. So,
thank you so much. Please join me in thanking Steve Ballmer.